If you've been exhausted or you feel like you might have a new diagnosis of ADHD, you can't focus, it feels like your brain fog is just getting worse, then you might be experiencing signs of low testosterone. I'm Dr. Jen, double-boarded OB/GYN integrative medicine, and I do a lot of videos specifically about women in midlife, perimenopause, menopause, but I also love talking about longevity. How do you feel great now and in the future? If this is something that you're interested in, please like and subscribe my channel. And let's dive into 6 signs of low testosterone and what to do next. I realize this video will be somewhat controversial because I know testosterone is still something that we really don't appreciate very much in women's health. And there's so much value to testosterone. It's one of the main 3 sex hormones that we talk about all the time. So estrogen, progesterone, testosterone. And remember, estrogen compiles 3 estrogens: estradiol, estrone, and estriol. So testosterone, why is it so important? Why are we even talking about it? So testosterone is wildly studied in other countries, to be honest. In other countries like United Kingdom and Australia, they actually have testosterone replacement therapy for women. But in the United States, it really hasn't kind of caught on. There was a company that attempted to get testosterone replacement therapy in the early 2000s, but due to the WHI trial, they were actually put off and told there was not enough data to actually approve their FDA-approved product. But there's so many more conversations now, so much more information, and honestly, I think testosterone will likely be approved for females in the next 5 years, which would be amazing. But testosterone, we think of it as a libido hormone. We think of women only needing it if they either want to bulk up like a bodybuilder or they need it for libido. But it has so many more uses than that. There's such good benefits of testosterone to brain, to muscle, to bone, even to heart. There's even data that supports that it helps heart health. So how would you know if you're experiencing low testosterone? And this is not just a video for midlife women. To be honest, women in their 30s, I see them that they have low testosterone as well. It's testosterone over your lifetime just continues to go down with age. It's not just a perimenopause, menopause acceleration. You can notice women who have low testosterone in their 30s, 20s. I even have some women in their 70s with normal testosterone not needing replacement. So it just declines with age, and it's at a very different rate for each person. So here are the signs that the 6 signs you might be experiencing low testosterone. Sign number 1, low libido. That's the one that most people recognize. So low libido, testosterone is so important for what we call arousal and desire. So low libido is a big, big category. And there are components of that. It could be that people have low libido because they have pain during intercourse. Could be that they have low desire, they have no interest. It can be that women have, or they can't orgasm while they're actually having sex, and that they have desire, but they organically can't actually orgasm. So there are a lot of components to desire and to libido. But testosterone works in the brain and also the genitalia by improving blood flow to the genitalia and telling the brain, yes, this is an awesome activity, this is rewarding, we should do this. So low testosterone is often associated with low libido. Number 2, losing muscle mass. Testosterone is important for muscle. So when you go to the gym and you're working out and you're lifting weights and lifting heavy and you're not noticing any, bulk, like where's the tone, why does it feel soft and I'm not gaining any muscle? Testosterone, a low testosterone level can have you not really gaining muscle, and you're losing muscle with age. So women will often notice it just becomes more soft and not really reflecting the work that they're doing. Number 3, difficulty with fatigue and just low motivation in general, just feeling like, ugh, I just don't want to get going. I'm tired. I hit the wall in the afternoon. Very commonly, women will say, I just feel like I just don't care. I don't have an interest anymore. What I used to love, I just don't care anymore. That can be very much a sign of low testosterone. Number 4, brain fog. And brain fog really, again, a big term too. Sometimes brain fog, people will say brain fog, but they could mean that they're having difficulty finding words like memory recall. It could be that they're having difficulty getting a task done. And brain fog with slower thinking is what's associated with low T. So where you feel like you're kind of can't get through that project, like something you do all the time and you just cannot seem to get the same motivation and the same progress in that project. Oftentimes difficulty concentrating. This is why women will say, I feel like I have do I have ADHD? I never had this problem, but now I have a problem with low focus and the ability to get tasks done. That can be a sign. Number 5, low stress tolerance. So normally you can deal with things that kind of come your way, and now you feel like everything kind of crumbles and falls apart. You're not able to deal with stress, not only physically, but emotionally and mentally as well. Number 6, weight gain in the abdomen. So testosterone is actually a slimming hormone. And so when women start noticing they can have weight gain in the midsection, this can also be cortisol as well, but it's associated with slower metabolism because you have less muscle mass. Muscle can actually burn calories and at rest and in motion. And so when you're actually when your muscle mass is going down, your metabolic rate is also going down, and you tend to start gaining weight, especially in the midsection. And you notice your shape is kind of changing, even if the scale isn't necessarily changing. So if you experience these 6 signs of low testosterone, what do you do next? First of all, you need to get tested. There's no cycle-specific way to know, do I have low testosterone or not? So you need to actually get tested to find out, do you have low testosterone? And when you do testing, your doctor should make sure they're getting free testosterone, total testosterone, DHEA, sex hormone binding globulin, and CRP for inflammation, because you need a bigger picture of the androgens. And because we can make androgens in our ovaries as well as our adrenals, we want to make sure we're getting an adequate sample. So making sure you get tested. You can also build muscle by doing weightlifting and doing strength training, which actually improves your testosterone levels as well. And then lastly, you can consider testosterone therapy. There are providers who prescribe testosterone therapy who are very much aware of how it should be prescribed and the data that involved with women. And so making sure that you see a menopause specific provider who understands testosterone is really, really important. That's something I do every single day in my clinic when I see my patients, is talk to them about the benefits and risks related to testosterone and the different ways you can actually get it, because it's not FDA approved. It's often done with compounding. Okay, so low testosterone, those are the signs of low testosterone. It doesn't always mean it's associated with aging. It can actually happen in someone who's in their 20s or 30s. If you found this video to be helpful, please like and subscribe and share with your friends. Can't wait to see you at the next video.